Hi everyone. ADR reporting is a responsibility of every doctor and healthcare professional. Today I will demonstrate how to fill the ADR form in a very simple and exam oriented way. This is also very commonly asked practical in exam in second year MBBS. So let us begin how to fill the ADR form. So this is the suspected adverse drug reaction form that we will fill with the help of one case narrative. So exercise is fill up the ADR form with the help of following case details. Name of the patient is provided, Ramesh Patel. Age 32 years, male, 65 kg weight. Diagnosis is acute bacterial sinusitis. No history of allergy and no history of diabetes or hypertension in family. This patient was treated with the tablet amoxicillin 500 mg 3 times a day for 5 days. On 1st March 2026, patient was started with this treatment. He developed generalized itching and skin rashes over the chest on 3rd March 2026. The drug was stopped on the same day and he was treated with the antihistaminics. He recovered completely by 6th March 2026. And now I will show you how to fill up the ADR form for this patient case details. So first part is the patient information in the suspected adverse drug reaction form. So first you have to write down the patient's initial. So here it is Ramesh Patel. So you have to write the initials, that is RP. We have to mention only the initials to maintain the confidentiality of the patient. Age 32 years. Then you have to tick mark on male and the weight is 65 kg. So this completes your patient information. Now second part is suspected adverse reaction. Here you have to fill up the date of the reaction started. So this we have seen that the reaction was started on the 3rd March. So here you have to fill up that the date of the reaction was started on the 3rd March 2026. The date of the recovery for this patient is 6 March 2026. So we have to fill up here 6 March 2026. Then describe the reaction or problem. So here you can also write in a very brief way, or you can also write generalized itching and skin rashes over the chest on starting amoxicillin tablet. Now coming to the suspected medications part. So here you have to write the brand name or the generic name of the drug, whatever is given in your case. So here you have to write amoxicillin, then the manufacturer, batch number and the expiry date. If it is mentioned in your case, then you have to mention here in the form. Then you have to write down the dose used. Here for this case 500 milligram, then the route, that is oral, and the frequency 3 times a day. So we are writing it here as a TID. Now the therapy dates, if it is unknown, then you have to give duration. Here in this patient the dates are given. So we have to write the date started, that is the 1st March 2026, and date stopped, that is 3rd of March 2026. So here we are talking about the suspected medications. Most of the students fail to answer here properly and they write the reaction dates. So you have to see properly which part you are filling when you are filling the ADR form. Then the reason for use or prescribed for. So amoxicillin here it was prescribed for acute bacterial sinusitis. So that indication you have to fill up here. Now reaction abated after the drug stop or dose reduced. So this part you have to write yes, because in this patient the reaction has disappeared once the drug was stopped. If the reaction has not disappeared, then you have to tick mark in no section. If you are not knowing about this part, then you have to tick mark that it is unknown or not applicable. And if the drug dose is reduced, then you have to tick mark here. So this is the section where you have to just tick mark whatever is applicable. Then another section is reaction reappeared after reintroduction. So this is known as re-challenge, and here the drug is not administered again. So we will not do anything here, or you can just do tick mark on the not applicable. So whatever the case detail is provided, based on that you have to tick mark the appropriate section. Then the next section is concomitant medical product and therapy dates, including self-medication and herbal remedies. Exclude those used to treat reaction. So here in this case only amoxicillin is prescribed, no other drug is prescribed. So here we have to write not applicable. For example, if other case is provided to you and concomitant drug therapy is prescribed to the patient, then that drug you have to mention here. Now coming to the relevant test and laboratory data with dates. In this patient, there are no such lab data are provided, so we will just write not applicable. If it is provided to you in any other case, then you have to write down the dates or the test or laboratory data. Now coming to the relevant medical or medication history. So in this part, allergies, pregnancy, smoking, alcohol use, hepatic or renal dysfunction, all these things you have to write in this part. In this case, it is provided that the patient is not having any history of allergy. So you have to write it here. Now coming to the seriousness of the reaction. For this case, this reaction is not considered serious, and if the case which is provided to you, if it fits in any of these following criteria, then you have to tick mark the appropriate box. For example, if it has caused death of the patient, if it is life threatening, if it has caused initial or prolonged hospitalization, disability, congenital anomaly, required intervention to prevent permanent impairment or damage, or if any other, then you have to specify it here. So this was about the seriousness of the reaction. Here again you have to just tick mark on the appropriate box. Now coming to the outcome of the patient. So here the patient has recovered, so we will tick mark here. If any other case is provided to you, whatever outcome of that patient is mentioned in that case, that you have to tick mark in the appropriate box. So it can be fatal, continuing, recovering, recovered, unknown or other, then you have to specify it. So this was about the outcome of the reaction. Now coming to the last but not the least part, and that is reporter details. So here you have to mention the name and professional address, PIN code, email address, contact number, your signature, occupation and causality assessment if you are able to do. For causality assessment, I will make a separate video in which I will show you how to do the causality assessment for the adverse drug reaction and date of this report. So this completes the step-by-step filling of ADR form. So this case exercise which is provided to you, that is type B ADR, it is unpredictable and it is not dose dependent. Now coming to the essential information for the ADR reporting when you are reporting it in VG-Flow or when you are reporting it to the NCC center. So the essential informations are patient initials, date of the reaction started, describe the reaction or problem, name of the drug, concomitant medications, outcome of the reaction, name of the reporter and date of the report. These are the essential information for reporting of the ADR. Now during the filling of ADR form, patient's identity is strictly maintained under the confidence and it is protected throughout this process. Submission of the report does not constitute an admission that the medical personnel or the manufacturer or the product has caused or contributed to the reaction, and submission of ADR report does not have any legal implication to the reporter. So this is very important information. So proper ADR reporting will help to ensure patient safety and also helps in drug monitoring. For more such simple and practical topics, subscribe my channel. Thank you.